Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and you have found the Truth Behind Dentistry podcast. And today, I am thrilled to have as my guest Risa Cohn. Risa is the Director of Student Activities at a private college in New York, managing all interdepartmental collaborations, academic workshops, and philanthropic partnerships. That's quite a collection of words there. She's also the founder of Elix Collegiate, a professional development platform for college students ready to pursue internships and early stage careers. Through virtual and asynchronous workshops, student participants become equipped with the skills and confidence to successfully navigate their career journey. After years of observing the gap in the life cycle of a college student that led to struggles transitioning from academia to the professional landscape, Risa designed Elix Collegiate to sit at the intersection between a student's academic and career goals. She supports students in their undergrad, graduate, PhD, and postdoc programs by curating engaging learning experiences to elevate their personal and professional growth. Welcome to the podcast, Risa.
Thank you, Dr. Norton. I'm so excited to be here with you.
Great. Well, I'm excited to be here with you, so that makes it perfect. So, yeah, that was a lot of things,
Yeah.
and I'm excited by all the things that you are taking on, and just the things that you've seen. I mean, part of it is awareness, right?
Yes.
Awareness of need. Where are those gaps? Where are we intending to accomplish something, but it's not maybe all that it could be, or people are getting stuck someplace and we need
Mhm.
breakthroughs. So I'm loving that you're in that world, having those experiences with people, and then you're creating, you're not just sitting there, you're creating creatively, uh, finding pathways through for people for real solutions. So I think there's so much here because I think it's true in your specific, the world of your school and in this particular professional area, but I
Yeah.
think it's true in general for
Yes.
college transition to career life. So let's just jump right in. So
Sure.
what issues have you observed from the dental hygiene graduating student community
Yeah.
as they transition into their profession of study?
Absolutely. So, I first want to acknowledge that, the dental hygiene major it does require a mandated skill set to be developed in order for student dental hygienists to take their board exams and certifying them to become registered dental hygienists. I've observed that students become very immersed in the requirements of the curriculum, which consists of clinical and didactic courses. They're committed to becoming highly adept and proficient in clinical skills, which will inform their patient care. They pride themselves on their patient education and then curating daily routines of preventative care. I have so much admiration for them. They do have a heightened awareness of how certain communities do struggle with access to dental care, and they're very focused on being of service. Their entire lives from starting dental hygiene school throughout the entire time of the curriculum is completely focused on their lectures and clinic. Due to this, I've observed that there is a very limited space in their education for them to learn about how to design a polished resume, as well as how to prepare and communicate during interviews. The first few interviews that they experience is when they have the greatest amount of self-reflection, and that's when they start to evaluate the type of support they needed prior to or upon graduation.
So are you seeing these issues as something that ultimately the schools themselves need to get better at delivering some of these connecting links? Or could we say that some of it's outside the province
Yeah.
of this of what the school is capable of doing in terms of like focus, like we've got to deliver all the clinical stuff and knowledge, but maybe we can't, that's maybe they got to find another avenue, is that?
That it's a little bit of both, I'd say. I think there is a very limited time. We all know that dental hygiene programs are state mandated curriculum, so they have X amount of hours they are expected to be in clinic, X amount of hours that they are expected to perform during their lecture, and these protocols have to be approved and confirmed and completed by an X date. So it does not leave a lot of time for them to work on polishing their professional persona. And that's what I've observed. And there's always room for students to come back in many schools after graduation and work with your career services department or your alumni affairs department. But I do believe that what I have identified is something that it's 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 definitely something that needs to be more so reevaluated prior to graduation so that students can feel confident upon that transition and how they can be supported.
Okay.
Yeah.
Yeah. So what do you see kind of from a symptomatic standpoint
Yeah.
as, okay, so we've graduated, we're approaching graduation, we've graduated, now we're kind of thinking, I guess we got to move out in the job market.
Yep.
What are some of the symptoms of this not working? What are you seeing the consequences being for hygienists as a result of this kind of deficiency?
Absolutely. So, one of the first attributes I've observed is that once they complete their competencies, they're only focused on passing the board exams. So they go into study mode, they go into hermit mode. Again, they're not practicing their dialogue, they're not curating their professional identity. So upon passing their boards, and they should always celebrate this, I tell everybody, please celebrate that. It is such a major milestone. That's when I've noticed that that's when they look at their resume and say, this is not up to par. They start comparing themselves to other hygienists in the field. They start going on interviews and realizing that they're struggling to communicate, that
Mm,
they didn't do research on the practice prior. There's different things that they need to negotiate that they weren't aware of, such as their benefits. So it starts to kind of compile. I tell students all the time, your resume will get you the interview, but your interview will get you the job. And
mm,
I've seen students struggle in the in between once they're in that competitive landscape of that job search. So what I observe and continue to work with them on is their resumes, their cover letters, their interview prep, which also includes salary negotiation and benefits. They have anxiety in the job interview process, which is really related to that dialogue and communication. So I always recommend doing mock interviews so that they can practice speaking. I also notice that during the interaction, I teach them the type of questions they should anticipate because they all say to me, I didn't know what to ask. I didn't think to ask that. I didn't know I should have asked something like that.
right.
So teaching them what type of questions they should anticipate and the information that they should be researching in advance, not just on the practice, but on the dentist themselves. What's the mission of the practice? What's
Right.
their values?
Right.
What has the dentist done in his field that you can speak upon and show your knowledge base of? Each session that I do is very personalized, and I like to focus on their verbal delivery, their energetic cues, and the way they present themselves in their new identity as a registered dental hygienist.
Do you teach them to smile as well as you smile?
I do teach that. Yes, I always teach that. Some
Yeah.
students, they get so nervous
Yeah.
that your brain contracts when you get nervous. You become a very narrow version of
Right.
yourself, but when you relax, you open up and you can deliver. So
Yeah.
I always tell them, nobody wants to work with someone who isn't fun. Be excited about being
Right.
there.
Right.
Show that
Yeah.
you want
Right.
this position.
Yeah. Right. It's a first date, right? So
Yeah,
if it was a personal relationship and sometimes that was the first date, then we may not be expecting a second date sometimes,
correct.
right?
Great point.
Yeah. Um, So let me ask you this. Is there a disparity from your experience, your perspective, between, even though we could maybe say that all the schools are falling short of fully equipping people for these sort of interpersonal skills or ways to transition into the work world, are there some that are doing better such that or they're just, or are we just saying that some people are going to be naturally by their strengths more inclined to succeed in that, therefore there's a gap for some people who haven't been equipped and but it's not really naturally in them, or are some schools better than others? I mean, what do you think the variables are that are being an issue for some graduates?
I have to be completely honest. I have seen, I work with all majors. This is an issue I see across the board in all schools, most majors with I can say business, they do the best in their preparation of their candidates upon graduation. Um, I feel certain students who have more of an outgoing personality, they do a little bit better. They
Yeah.
understand that there's a very big personal component to forming a relationship with the patient. I've had many dentists say to me that when they observe dental hygienists in the chair, they really appreciate the type of relationship they form with the patient to calm them
Yes.
down, observing their cues.
Yes.
I think that's something to be aware of also during your interview process, right? You want to show that you are able to anticipate what that patient needs and that you can read their cues, even if they're not talking their body language. What are they saying to you about being there? So, this is why it's so important to anticipate in advance what would be expected of you on an interview, and how you want to showcase yourself on the resume first. What your resume is going to reflect not just what you've done in clinic, but also your values as a dental hygienist. I've had so many dental hygienists talk about that they want to work with very specific populations. That can be showcased in your resume and on the interview, but we should talk about how you want to do so.
Right. Yeah. And then will that office be a good match for that you really wish to deliver?
Correct.
Yeah. Yeah.
Yeah.
Good. I agree with you on some people being more naturally suited. And I think sometimes we're talking, I mean, you and I have had conversation before about the assessments that I use
Yes.
and for ways to locate where are the strengths. We don't all have all strengths, right? So,
Thank you.
so we're going into uh, specifically in dental, we're going into a career that does require precision, that is more analytical, that there's specific procedures and protocols and those things that fully reflect some people's great strengths.
Thank you.
But just like a client doctor yesterday, I was just having this conversation with, who apparently the person did well enough upon interview to get
Yeah.
the job, right? She was hired.
Right.
And I do believe that is, I like the doctor. I think it is a good growing practice.
Yeah.
However, uh, there's already been feedback that some patients don't want to come back and see her.
Mm.
And upon further questioning, I said, would you say that it's because her clinical skill set? She's very young. She's just 21, I think he
Yeah.
said. So he
Right.
said she, in many ways, for a 21-year-old, he says, if I think back on where I was when I was 21, I almost couldn't couldn't say she should be better at anything.
Right.
But he said it's there's some things she's getting better at with her technical skill sets, but he said that's not really what it is. So to the point of our conversation, it's her lack of interpersonal skills. And one thing I was able to see on her cognitive styles assessment fits exactly, I think, what we're saying, that when she was in learning mode in school, which was
Yeah.
information, ideas, conceptual things, and she was very low on relationship scores, on emotional agility.
Yeah.
And so he says she's not connecting with people.
Right.
And so they're not really feeling, since there's not much connection, and which leads to communication, she's not really um, influencing them in any real positive way. And
Yeah.
they're not liking her, even though she might be a likable person
Yeah.
in that situation. And so there's stress throughout the entire office
Yeah.
based on this, which makes me all the more think what you're offering is an absolutely necessary collection of skills.
Thank you. To your point, one thing that I do like to make these students aware of is that you're touching people, you're touching them, and that's a boundary. So, what are you going to do to make them feel that they're in a safe space? And that is something that I like them to address when they are in an interview. I like to teach them how to bring up those types of conversations if it's not initially cued by the dentist that they're interviewing with,
Right.
because that's really important for sure.
Yeah, we have to be really good at our technical skills, but it just proves it can't end there.
No,
There's people that you have to build a know, like, trust relationship with, and they don't know you. But I think that the hygienist has that is expected to have this key communication connection role in the office.
This is something that I've heard the deans of the dental hygiene program talk about, that it is intuitively built into the curriculum that when they are observing their students in clinic interacting with patients, they do have an expectation of the way they speak to the patient, the type of procedure they explain. Literally, I've seen the deans come and re-cue their body
Hmm.
so that they are in a position that is going to be comfortable for the patient when they are working them. So I think it's really important to understand that it's it's a duality of comfort here. You want to create a relationship with the patient because you are going to be walking them through a process that for some might be very uncomfortable, but they have to trust and allow you to do so. And it all starts with the type of professional that you bring to them in that 45-minute session or whatnot.
Yeah, that's great. I think too much is relied upon just kind of hoping that accidentally this will all work out,
Yeah.
or the sense that I'm making just an intuitive sense of things, but I haven't, as a person hiring, maybe I haven't done all my homework to really verify if you are going to thrive here.
Yeah.
And as the person applying, maybe I haven't done all of my homework in being prepared to apply.
I think that to your point, this is where dentists really have to evaluate the type of practice they have and the type of hygienist they want.
Yeah.
Because the hygienists, I believe that they're the ones who support recruitment and retention, right? It's they're the ones who the patient is going to have sometimes longer interactions with when they do go to the dentist. And I know so many people, including myself, I specifically request certain hygienists. I
Mm.
look forward to going back because I know I'm going to have a positive experience.
Yeah.
And that supports the practice's retention in their patients. And it's a life cycle that dentists need to account for.
Yeah, and it's almost as though the hygienist, or maybe not almost, maybe it is simply that the hygienist is possibly the most important person in the practice because
Yeah,
they sit at this junction point
correct.
between the business of it and the people dynamics, and they're seeing the hygienist more often, really, in a sense, than they're seeing the doctor, right?
That's a fact.
So maybe
Yes,
I kind of like the doctor, but if I love my hygienist,
right.
I'm coming back, right?
Correct.
Or
You'll
I'll
come,
leave and follow the hygienist to some other place if I really like
right.
the hygienist.
That relationship is imperative to how that patient is going to take care of themselves after they leave. And that's something that, like I said, many student dental hygienists, that's what they pride themselves on: patient education and creating a daily routine that's going to work to support that patient's preventative care. So it's that relationship that you build that's going to instill that in their patient, that I care enough about you to design a routine that's going to support your oral hygiene. And how are you going to communicate that to them? So because as we all know in the medical field, there can be different diagnoses that are very difficult to discuss
Right.
and very difficult to share and talk about. So how are you going to communicate? And I always tell one thing I always talk to the dental hygienist about is think about how you're going to communicate to a patient whom you might see decay, whom you might see an eating disorder visibly going on,
Hmm.
whom you might notice certain types of buildup. How are you going to share this with them? How are you going to teach them how to take care of themselves? Right? How are you going to ensure that they can get better? So I do think that there is a great, big, interpersonal dynamic and communication skill that will serve them greatly if they can really lock that in and take inventory of what they need to do to serve that patient.
Yeah, that's great. I mean, it really is an important role that can be very empowering in terms of the value that you're delivering, the value you're adding to the success of the business, but also to the well-being of patients.
Yes.
And yet, the flip side of that to me is that there can be a lot of pressure then to be carried by that
Yes.
person to the degree that they're somewhat ill-equipped.
Right.
I have that opportunity, but I also carry the burden, and I'm not sure I've been prepared fully for the burden, right?
It's very true, and this is exactly why clinic is so deeply emphasized in their lifetime of school in the dental hygiene programs. What I have observed is that many students come in knowing they want to work with a specific population. So they will have the opportunity to connect with professors who can curate their learning a little bit differently in terms of like, here, do some more research on this, or, here, we're going to do a project on this, focus on that topic that's interesting to you. And it is very much so. The dentistry is very dynamic, and what we do know is that the mouth connects to so many different parts of the body,
Right.
and disease. We do know that disease does start in the mouth at times,
Yeah.
and that's why dental hygienists are so important to our well-being in society. And one thing that many of the students also recognize is how there's a component of fear with going to the dentist, and if they can help a patient get through that, that is a win in
Right.
itself. So I always encourage them to think about how do they want to share their values as a professional when they go in for that interview?
Mhm.
What do they want to communicate about themselves? But you have to, again, doing your research on the practice in advance, seeing who they serve. What type of community do they serve? What are the issues in that community? What are the dentist's values? Why did he start this practice? Who is he looking to serve? And so forth. It's very diverse, the dental community, and there's so many opportunities to work with different populations. So, what your heart desires, you can find there.
Yeah, that's a good point because I think there is that possibility that it could seem like, well, that's the role, and therefore it's a bit more one size fits all. But that's far from what you're saying, and from what I understand, it's far from the truth that it is a one size
Correct.
fits all.
Correct. Absolutely. I've had students who their goal is to work anywhere from pediatrics to geriatrics to PTSD, domestic abuse survivors,
Hmm.
um, drug addiction, you name it. All different categories of patients that they want to serve.
Yeah, that's great. We've kind of already been talking about, or you've shared some things that I think are very helpful as far as recommendations for ensuring that the students are prepared to graduate so that they can have that best chance to land those best positions. But what other things have we not covered yet that you'd like to add in as other key elements?
Absolutely. So what I always encourage dental hygiene students to do is to first connect, if there is, with a career services department in your school. Let them review your resume, take on their edits, schedule time where you can practice your interview edit and ask questions. Second, get a second set of eyes on that resume. It's critical. You also want to have someone you can practice your dialogue with, connect with your dental hygiene community, see what's going on and what they can recommend in terms of your delivery, right? Straight from those who are already in practice.
Mhm.
If your dental hygiene school doesn't have a career services department, again, you connect with your professors and your deans, and they will take the time to work with you. Professors are there to give you guidance and feedback as part of your development in school and so forth. It's all about that transition out of dental hygiene school into being successful. And then third, this is really exciting. If anyone is interested in taking it further, check out Cloud Dentistry's website. I'm going to be doing a professional development workshop with them on May 15th entitled Best Practices for Interviewing. We're going to go through everything that dental hygiene students need to feel confident as they move into this new phase. So we'll be doing the elevator pitch and communication, research, attire, positive affirmations, and more. Cloud Dentistry is a staffing agency for dental hygienists, and they have a really cool platform called Cloud University where they work with students and provide them all types of resources to support the launch of their career. So check it out.
That's awesome. Well,
Thank you.
congratulations for
Thank you.
having the opportunity and seizing the opportunity to make that
Thank you.
contribution. It
Thank you.
definitely is needed. So that's great. And
Thank you.
and so I think as we release this episode, there should be plenty of time for people to grab a hold of that opportunity. So
For
so
sure.
so for people who want to know more about the other work that you're doing, so maybe
Yeah,
a little bit about Elix Collegiate and
absolutely.
your passion behind that.
Oh, yes. So Elix Collegiate was born out of many, many years of observing and recognizing that there was a gap in students' learning as they were transitioning from their lower classmanship to upperclassmen, in the need of getting a curated resume and needing to get very polished for an interview for that dream internship. And then eventually, junior, senior year, that dream job. I observed students who would go to their career services department and they would be helped by an underclassman and didn't feel that they were getting the support they needed. Others said they didn't even know they had a career services department. So I'm observing this and I'm doing my due diligence and I'm taking in all these different elements from my geographic assessment of working with students from across the country, all different types of universities and colleges. And that's when I decided to build out Elix Collegiate. I offer different types of workshops that support things just like their resume design and interview preparation. And I also work one-on-one with students so that they can gain the right skills according to their passion and how they want to show up as professionals in the professional arena. So, I mean, I have boot camps. They're intensives, right? Like 1.5 hour, 2 hour workshops. I have cohorts as well for students to join, but I really pride myself on curating very specific content that it kind of gets through the banter of everything that's out there. There's so many different resources, but I really pride myself on getting straight to the point and really understanding exactly what students need. I want them to know that everything they do is they have the capacity to grow and build upon themselves. What they did in their academics can be transferred into their careers. And I like to showcase that in the types of workshops that I do so that they can get a new vision of who they are and what they stand for upon graduation.
That's awesome, Risa.
Thank you.
I'm inspired. Makes me want to
Thank you. Thank you.
sign. Yeah, so I think that's it's a critical need as we've discussed, and I
Yeah.
feel like you are that right kind of well-informed, skilled, and almost like I picture you kind of like being a not only an educator but a cheerleader for people
Yep.
to be able to thrive, to be able to
Thank you.
succeed. So,
Thank you. I
so
pride myself on that. Thank you so much.
yeah.
Absolutely. I'm a big, big advocate for our students and 100% a cheerleader.
Yeah, I can tell. And I'm sure
Thank you.
everybody is blessed by that relationship with you,
Thank
having
you.
you in their corner. So,
Thank you
so
so
for
much.
everybody who says, well, I recognize the need, I want to talk to Risa, I want to know more about what she's doing, what's the best way for people to get in touch with you?
Yeah, if they check out my website, they can shoot me an email or just sign up to like learn more about the types of workshops that we do offer.
Okay, so elixcollegiate.com.
.com.
Okay, and
Yes.
Elix is Elix collegiate.
Yes.
If you don't know how to spell collegiate, then I guess search for that, it'll show up, right?
Yes, thank you.
So for everybody who is watching, I'm certain that they've gotten a lot out of this, and I think there's some people who are getting nervous right now that we're going to end this, and this is all they're going to get of Risa. I just want to assure everyone that is not the case. We're going to do more of this. We're going to bring you back, and we're working on a project to be able to have you kind of take your own corner of this truth behind dentistry element and
Thank you.
to draw out more elements, more truths needing attention, and additional insights for hygiene for the hygiene world, especially.
Thank you so much. I am so excited to continue this. I want students to really lean into the content that we co-create together and absorb it and apply it so that they can feel absolutely amazing when they step into that arena.
That's great. Well, thank you. We've been blessed with Risa Cohn being with us as our guest
Thank you.
today, and we look forward to more. This is Matthew Norton, and this has been the Truth Behind Dentistry podcast, and we'll see you again next time. Thank you.